department. So if you ever need medical records, you would come into my department to request those records, or if you needed them for continuation of care or to go to your insurance company, that's my department. So I'm happy to give you your tour today. We're going to start on A level here, which is the surgery center. And we have a volunteer assisting us in the back. I'm not sure who our volunteer is. Two of them. Hello, wait. What are your names?
Phil. And King.
Thank you.
If you need assistance, restrooms, pushers, whatever.
Okay. So, in 2011, it marked the 125th year of our hospital. Benedict actually started the first hospital in this community in 1886. So we've been around in the community since 1886.
You've done well.
Thank you. This hallway is going to not be open to the public after this. So this is an exclusive look at the surgical suite. So this is where the doctors will wash up before they go into surgery.
Just like Grace.
I know, I'm like, I don't know what I need, but I really want one. I'll be the first to try out. When the sisters
going on now?
What's that?
Is surgery going on now?
No, we're not at this. Suites aren't open just quite yet. We're gonna actually go into a room here shortly so you can see it.
The first surgery is scheduled for the day after Memorial Day.
Thank you.
So I'll help out a little bit with stuff I maybe know.
Okay.
So when you're knocked out, this would be your
You could be
tour. This
You won't
is your,
remember it anyway.
you know, you're not gonna remember it anyway. So
We're actually gonna go in here. We're gonna wait a little bit here. Sorry, we must have went a little too quick, but that's okay. So I'll just give you some more background onto the hospital while we're waiting for the group ahead of us to finish here. So we built back in 1886. In 1926, we actually built on this site, and a lot of people thought it was the wrong site to choose. The hospital was too big. Their vision for the future was brilliant, though. In fact, we still use the original building more than 80 years later, and that's where I'm housed, is in the original. So C lobby, when you go into the hospital, is the original, and the original doors on the C lobby, those are beautiful. They're gold.
so they're ready if
Okay.
you wanna.
Our first tour stop is an orthopedic operating room.
Wow.
Let us have one.
Well, this is an orthopedic OR. This is OR number 22. As you can see, it's very large. It's about 750 square feet, which is almost double the size of our current OR. And as you can see, there's lots of technology in the room here. We have an in-line camera here that we're able to take videos, EVs, things like that for teaching and for the surgeons. We also have a navigation system. That's what these trackers are. They get read by this camera up here, and they can pop up on this monitor. That just makes for more precision cuts for the surgeons as well. We do have 4 monitors in the room. We're able to put different things on each of them if we'd like. We can pull up x-rays, have camera, navigation, so you can change that all around. The whole brains of the whole room in this cabinet right here. The convenience of having it in this cabinet here is IS can work on the other side without having to come in the room during the procedure if we would need it.
What is there?
That's kind of like the brains of the whole room.
Oh,
It's all the computer integration.
Oh, okay.
We also have microwave switcher over here as well. If we need to sterile supplies during the case, they're able just to put it in these cupboards and we're able to take it out on this side.
So the important, are you okay if I interject a little bit?
sure.
So the important thing is that they open on the other side, so you don't have people coming in and introducing new germs while you're in surgery. So they put it on the other side and we open it.
We also have our dual chair charted to our new ORs. This just prevents any cords from being on the floor. Right now, we currently have these carts that we wheel into the room, have to get extension cords going to the wall. So we're able to keep all the cords right on this boom here. And we're able to move that all around the room depending on the type of surgery and our need.
Wow.
It even has lights on the side.
Are we doing a knee replacement?
Yeah, this would be set up for a knee here.
been there.
I got a couple of those. That's what's in my needs. Denise will tell you about our air exchange. If you feel like the room is a little bit windy and very cold, it's because there's an air exchange that's going on 70 times an hour. The air is getting exchanged, and it's creating clean air for the patient. 99.97% of germs are getting filtered out of here. So it's very clean air. It's coming down through the center and those vents to the operating room field, and then getting swept across the floor into these vents that are alongside the four corners of the room. If you want to see how good of suction they have, my paper's kind of heavy. It just sucks it right out.
Wow.
A normal office air exchange is about 10 to 15 times an hour, and this is 70. So, and that's an orthopedic room. Other operating rooms, it's usually about 30-ish times an hour, and orthopedic is more frequent because an orthopedic infection is harder to treat, and so our surgeons are focused on cleaner OR air. Any questions?
Yeah.
So I maybe have one, I kind of know the answer, so I'll just say this. This is the most technologically advanced OR between here and the northern border. There are others that are like this down in the cities, but because of this air exchange, if you look over on the wall here, right now the air exchange is 71.5 times
An hour.
an hour. So more than once a minute. All of the air in this room is being exchanged. So,
Like working here.
yeah,
You're very awake.
yeah. So,
Yeah, that same monitor there monitors the room temperature and the relative humidity as well. So that's another piece of technology we didn't have before. Just the old-fashioned burner, yeah.
so how about questions for any of the experts here?
Otherwise, I believe there are places along the back wall that have, the new units have people there to answer questions as well. So if you think of something on the way, you can always ask it at the end of the tour as well. So we're gonna actually go through this door.
Really like all the design.
Rehabbing July.
Come on into the OR.
Where are we going?
Arrow.
Hi.
Get up close there.
Right, this is
Close and see there.
Where did you get this? Who let you do this?
Okay.
They're not working, Barbara.
They're not working.